It's me. I'm back. You know, today, I went for a walk. Weather's gorgeous. Don't know if anybody else here has noticed. But go outside, take a walk. And what I do is I stop by the Starbucks nearby, get something to drink before I go on a walk. And I ordered a specific thing, and they gave me something that wasn't what I ordered. I don't know if this is like some kind of, I don't know, like a seasonal thing. But I tried it. It's actually pretty good. It's kind of like a milky strawberry drink. And yeah, it's not bad. That's one of those weird things in life is sometimes you get to try something new by accident, and you know, you got to try your best to enjoy it. I think it's pretty good. I just wish I knew what it was. Just so like, maybe I could order it again. You know, that's life though. Sometimes you don't know what's going on. A lot of times I don't know what's going on. But you know what? Who else? You know who definitely doesn't know what's going on? A lot of the things that we're about to talk about on Reddit. So here we are, the very first question, I guess, statement, however you want to put it. Some of these aren't really questions. Some of them are just kind of more like statements, but let's get to it. 31 female. I'm assuming that means like a 31-year-old, not 31 specific females, because that would be quite the elaborate question to have to answer. A generally sweeping question about 31 females. That would be a lot more tough. Anyway, 31 female, need most random, unhinged ways you got back to functional, getting desperate. That's a weird way to word that. But anyway, the way this works is she gave I believe this is an MRI report. There is no actual MRI to look at, so this time it'll be a little bit easier because I know diagnostic imaging has been something we keep doing lately. But this time it's actually just the report, which is just the word part of the whole thing. So the doctor looked at it and wrote some stuff down. And then there's the actual part of the question. So obviously with the way this is usually structured, it's like the thing at the top and then the question after underneath it. So I'm going to read the words first and then we'll go over the report. She goes on to say the injury happened in December, taking out subflooring. I don't know when this is 8 days ago, so that means that this would be in June, as a case of this recording. So it's been about 6 months, I guess, probably the way to put it. Injury happened in December, taking out subflooring, went to the chiropractor, and hey, good job. And that helped, but the 5th session in February felt off, and by Monday I couldn't walk and had emergency MRI due to loss of feeling on one side of my tailbone area. Photo of MRI results from February. Basically, back pain is gone, except in tailbone area. The main issue is muscles. My psoas and piriformis muscles and core work are the focus of PT and building muscle since March. They lock up and I cannot move. A YouTube hip stretching video helped, but I'm not making actual progress. Good for a few days, then a flare up, and I can't bend or walk, but can't sit. So I basically just stand in pain at work. I'm running out of sick time and I manage a theater, so it's getting obvious I'm doing less than I should, and my lift accommodation ended May 25th. I'm about to start a full anti-inflammatory diet to see if that helps. My whole body is weak from lack of movement, but I never was a gym person because of my work. I was a carpenter and moderately active before, so being this sedentary is affecting every muscle. I asked for a medically necessary massage referral and asked for muscle relaxers. I had them before, but was doing okay, so I wouldn't get a refill, and was on a second round of heavy steroids. When this started, that helped. Waiting for the doctor's reply. I'll take any and all advice. Nowhere in there did she say that she wanted people to give her unhinged way. I think this is a her. I think somewhere in there it stated that it was a lady, but nowhere in there did it actually say, hey, can you give me your most crazy advice? But I don't know. There's a lot of stuff in there that makes me think this isn't totally necessary for crazy advice. I think there's some stuff in there that's a little on the basic side. I say basic, like a basic way to treat it, not necessarily like it being like, yeah, this is like nothing. You don't have any problems. Yeah, she's definitely got some problems going on. I'm going to read the actual report. It's a little cut off at the top, and I'm assuming at the very top is probably the general impressions. So if you see that, and it's not scrollable, I'm pretty sure, yeah, it's not scrollable. So if you see that, I didn't cut it off. It just wasn't in the full picture. But anyway, it says hypertrophy noted. If I had to guess immediately what that means, the hypertrophy is probably on the facet joints, which it'll probably come up when we go over individual segments. I haven't actually, when I look at these, I just take quick glances because I want you guys to get like my candid views on them. Hypertrophy noted. Desiccation and mild loss of disc height evident at L4, L5, and L5S1. That's pretty common. That's usually where you notice that stuff the most. Other places, obviously, it does happen, but more, if you were to like do a 50-50 odd on it, it's probably L4 to S1, somewhere in there is usually where the disc stuff really starts to kind of get funky. Likely reactive degenerative edema noted along the left L4 and L5 and L5S1 end plates. Yep, that makes sense. Imaged portions of the soft tissues reveal no acute findings. that's interesting to know, because I think she said that this happened in February is when they took the picture, and she's been dealing with the symptoms for 6 months. Now, a lot can happen over that amount of time, which we'll kind of get into in a second. T12, L1 facet hypertrophy, no canal or foraminal narrowing. L1 to L2 facet hypertrophy, no canal or foraminal narrowing. L2 to L3, tiny disc bulge, ligamentous and facet hypertrophy, no canal or foraminal narrowing. That's interesting, actually. Ligamentous hypertrophy is interesting. You don't always see that, but that's actually good to know. L3 to L4, tiny disc bulge, facet hypertrophy, flattening of the ventral thecal sac without significant canal stenosis, no significant foraminal narrowing. L4 to L5, disc bulge with extension into the foramina. Foramina, it's always a fun word to say. Central and left paracentral herniation with annular fissure, ligamentous and facet hypertrophy, asymmetric encroachment of the left lateral recess and traversing left nerve root. Mild to moderate canal stenosis, mild to moderate left and mild right foraminal narrowing, disc bulge, central left paracentral protrusion, facet hypertrophy. Okay, so we'll go on and go through this bit by bit. This might actually be like a one question kind of video, because this we could talk about this probably for hours, quite honestly. The whole point of this of her asking this is that she's been suffering from this pain for about 6 months, and it sounds like she's really been trying to get it fixed, or at least treated in a way to where she can get back to functioning. And I would say that, again, if this person were to come to me, I wouldn't necessarily approach it from the we're going to fix the problem, at least at the beginning, especially if you have something that has entered the chronic phase. Since it's been 6 months, and it's probably safe to assume that she's been dealing with the pain and the discomfort pretty much the entire time, the first thing I would try and do is figure out how to get her to return to like a functional status. As in, what is it going to take for her to be happy that she can go back to work, even though she might not be super comfortable, but she's clearly not happy with the fact that she's using up her sick time, this is what sick time's for. I hate to break it to you. You know, you shouldn't just be holding on to sick time to use as like vacation days or whatever. It's actually to help you get better when you're hurt. She might be talking about it from the point of view of she doesn't have much more like time to give as for actually, you know, being sick. In this case, you know, having a lot of low back pain, which is probably the more responsible way to look at it. But regardless, I would say that she's definitely starting to feel the burn in regards to the socioeconomic part of the low back pain thing, because I'm assuming she doesn't want to lose her job, which would stink. That's a cool job, working on the floor of a theater like that. I would imagine that if you can work that way and survive, that'd probably be a really fun job, and she probably wants to keep it, especially if she's a carpenter. That seems like a dream job, if you ask me. You know, you figure she's been dealing with this for about 6 months, and the low back pain is gone. Now, that's interesting to note, because when you look at the MRI, you might think to yourself, oh, wow, this person must be suffering from a whole ton of low back pain. And when they took that picture, if they did take it in earlier in this, they went to the chiropractor of MRI results from February. Yeah, so you figure when she got that picture taken, she probably did have a lot of low back pain, or at least she did definitely in like the January, December type time frame, right? So you figure that might actually be gone, and they haven't taken a picture of it since. So if she is suffering from a little bit of numbness along the tailbone, now, and the first thing I always like to ask is, what do they mean by tailbone? Tailbone is one of those anatomical regions that people will kind of have like different definitions for. Shoulder is a really, really common one, and hip. If you actually look at it from an anatomical standpoint, the tailbone is actually a very, very small area. I'll probably put a picture here, but it's actually usually just maybe the tail end of sacrum, but most of the time it's only the coccyx. Coccyx is technically considered the tailbone, but almost nobody really refers to that area specifically without having this person in here to like actually like slide something on it to really determine exactly where the problem is, which is actually incredibly helpful for determining where the lesion or the problem, if it is a disc or something like that, might actually be manifesting. Because if it's S5 area, that is much different than the coccyx bone itself, or even further down, which might be going into the gluteal region, because that might be more of a lumbar problem, and you just kind of have to figure that out as you go. Obviously, we don't have that. We can't actually put, as I like to say, put hands on them to try and figure that stuff out on our own, but it does make you think, okay, well, where do we start, you know, trying to figure this stuff out? That would be the first thing I would do if they came to my office. And again, they went to a chiro before, and actually, it's funny, I had a patient just recently come in that said that she was going to another chiro, but they were really helpful, but it never felt like it was fully going away. The first thing I always like to say is I never want to assume that another medical professional doesn't know what they're doing. They got there somehow. They went through the same schooling, roughly speaking, that I did, and it's safe to assume that if they're able to survive in this world, they're at least good enough and competent enough to be able to, you know, get the job done. So if they're going to another healthcare professional and something's not getting completely resolved, the first thing I want to do is say, okay, instead of changing what another medical professional has decided to do, let's add to it, because what might be happening is that you're going to a certain person to scratch an itch, and they might be scratching it in a way where it's not completely fulfilling what you need done. if that makes sense. So in the case of the patient that came, just a little while ago, that has nothing to do with this question, her big issue was that she noticed that her pain goes away, but it would come back fairly quickly, and come to find out that the chiros weren't really stretching her legs out in a way that was helping keep the symptoms away. Was that a fault of the chiropractor? No, not necessarily. The chiro might have told her, hey, do these stretches on your own, and it might go away, and maybe she didn't do it, and blah, blah, blah. But it's not, in my opinion, kind or productive to, downplay what other people are trying to do or say when they are in themselves competent practitioners of whatever it is that they do. And I would never go off and say like, oh yeah, I'm better than everybody else or blah, blah, blah. But I would say that one of my strengths is definitely being able to see what has already happened and applying what I know on top of it, or adding something to it that might enhance the benefits of it. And I think that a lot of times that's all you're missing. So in this case, this young lady, I say young, again, I don't really have any, 31. Oh, yeah, duh, it says 31 female. Duh, that's why I know it's a female. I'm a genius. So you figure 30 is usually when degenerative stuff starts to kind of start, showing themselves off. So if you're at that age, and again, we're going to go back in the time machine back to February when they took this picture, facet hypertrophy doesn't just happen. Facet hypertrophy is something that has been building and building and building probably for years. And throughout her 20s, she was able to get away with it, especially if she's a carpenter, which is a pretty physical job. And carpenting involves a lot of like bending over. So she might be doing work in a way that the body wasn't a huge fan of. She's probably bending over her waist quite a bit. And if she has a weak core, that can cause all kinds of catastrophe with the low back. And when you have facet hypertrophy, what that means is that your discs aren't able to fight gravity properly, usually speaking. Of course, there's a lot of other reasons these things kind of might happen, but from a surface level of what I'm seeing, facet hypertrophy tends to happen when the facet joints are starting to take more of gravity when they're not supposed to, because that's what the discs are for. So that usually to me means that the discs themselves are bulging, or they're already starting to narrow in a way where they're not doing the job properly. And it may not necessarily mean low back pain, and it might not necessarily mean a disc bulge or a herniation where you get symptoms that go down the leg, but it does mean that biomechanically she's not moving in a way that the body wants to move, and it's altering the way that she is constructed to create more of that stability that the body's craving, because the core is not able to do it, and because the disc is not able to keep up with it. And I hope that makes some sense. Kind of went over it kind of quick, but that is ultimately, I think, where her issue is going to come from. That's the core cause, but the actual symptoms of it is the low back pain and all the pain and all that she's feeling in her low back and the tailbone area. So when you think about it, she says that her psoas and piriformis muscles and core work are the focus of her PT. So the PT is obviously at least aware of that, and that's exactly what she should be working on. Clamshell type stuff, core work is going to be absolutely fantastic. It sounds to me like her core is probably not super engaged, especially when you have as much facet hypertrophy. What I always like to think is that if there's something going on within the L1, L2, 3 area, usually the first thing I start to think of is leg. It usually means to me that the hamstrings are too tight or the quads are too tight, because, and again, this is purely my own conjecture. I don't know if there's any like specific, research out there that super supports this, but I've noticed it with the patients that I treat here, and I usually get great results, is if you're starting to have changes in the upper lumbar, lower thoracic spine, what that means to me is that it's not moving properly because the legs are too tight. Can I say that with 100% certainty with this patient? Of course not, because again, I can't put hands on her, so it's hard for me to fully say. But based on, in my opinion, the fact that she hasn't had full relief for her symptoms, it means something's not getting scratched. Like I said, is that because they haven't been stretching their legs? Maybe. Usually PTs are pretty good about that stuff. Again, there's a lot of stuff we don't have as far as like care plans. How often is she going to the PT? What is the PT doing? Is it only exercises? Do they do any, passive modalities? Are they doing any stim? Are they doing hot packs? It's hard to say without being able to talk to them directly. But again, these are just some of the things that immediately go through my head if somebody were to come to me and give me this amount of information, right? But it's good to know that the back pain's gone. That does tell you that whatever they've been doing has been working. And again, I think the competency of these medical practitioners is made apparent in that. But there's probably just like one little thing that's getting missed, whether that means it needs a surgical intervention. I mean, at 30, that's hard to say. That's right around the time where maybe like, I don't want to say it's definitely not exploratory, but definitely a situation where a surgery might be necessary if it's something that's just grown in a way that you can't change it. But obviously I'm always willing to do the conservative care first. In this case, she's been doing it for 6 months. Again, I don't know the full treatment plans. At this point, 6 months in, if she's still having these issues where she can't really work, well, then that's a bit of an issue, right? So good for a few days in a flare-up and can't walk or bend. And then there's my next question is, if she's not necessarily suffering from back pain, why is it that she's not able to do a lot of these activities? So she can't walk, bend, or stand, it seems like, without having some kind of pain. Where is the pain? Is it in the low back? She just said that there wasn't any pain in the low back. Is there only low back pain when she's doing specific things? That gives you a lot of really good clues. If there's a lot of disc problems, what I would almost guarantee you is that if she's in a gravity-defying position, it means that that's what's causing her pain because gravity's being pushed down on her spine, and then the disc is going off somewhere where it's not supposed to, or her muscles are not strong enough to accommodate her fighting gravity. She didn't say it happens when she lays down, I don't think. When she's in a non-gravity defying position, maybe it's better. Again, that's something that would be really good to know. She's running at sick time, and yep, she can lift accommodations. So she's about to go into an anti-inflammatory diet, which is good. Just kind of in general, especially if you're really sensitive to pain. Is it going to make it completely go away? I'd be kind of curious. What is she eating now? Is she eating really bad now and she's going to go from, 100% bad all the way to 100% good? I doubt that it would be quite that quick, but I know when you're in pain, people tend to eat bad because of the fact that they're miserable, for one, and then two, a lot of times bad foods are easier to get a hold of because, you can open up a bag of chips or whatever, as opposed to getting up and doing a meal prep for a week, but it hurts when you stand, so you don't want to do it. And that's just one of those what am I trying to say? It's like one of the mental aspects of being in pain is when you're in pain, you don't usually want to put in more effort for something that you think may not even tend to help you. So again, that would be something I would ask this person if they had come in. The whole body feels weak from a lack of movement, which makes perfect sense, but she's going to the PT and she said the PT's been doing exercises with them. Do you think that would be something that the PT might be on top of? Again, she might be catastrophizing it a tiny bit. Don't know for certain. Again, that would have to be something I talk to her about. I asked for a medically necessary massage referral and asked for muscle relaxers. I would be curious to know if she thinks that the pain is being caused by muscle. And there's a couple of things in her little testimony here that are kind of, I don't know, like they don't necessarily line up in a way. This would be somebody that they might say something to me, but you would have to like listen to between the lines. It would be like, I would actually have to physically get my hands on it and move it myself. And if I move it and it causes pain, well, then that's a little bit different than just saying, oh, my back hurts all the time, forever, always, all the time. And I don't know why. And the world is falling apart. And oh my God, please help me. And blah, blah, blah. Even though maybe when she's standing, it's not necessarily pain. It might be more like an ache. There's a lot of things that need to be defined. And again, it sounds like she works in the theater. I don't want to say she's being theatrical, but she might be a bit of a thespian. A thespian. And that's how I got into Juilliard. But yeah, so that's just some things that I would think of. Just my most recent comment. It might seem that I'm not believing her. I totally believe her. But the question is we need to define it in such a way to where we have the same vernacular that we're using in order to figure out what might be going on. Because if she thinks it's pain, her idea of pain might be a much lower number than what I consider pain. And it might mean that what she's complaining about with pain in one thing might be just a compensation in a way that it's actually being caused by something else. And we just have to make sure we're using the same vernacular. That's the only thing I would say about that. And then when you go into the actual MRI report, again, this is a little old because you figure we're sitting here in June and this was taken in February, and she's been getting treated. She went to the chiro at least, it sounds like before she had the MRI, which is good. I'm glad that she went there for, acute care. Is she still going to the chiro? I don't know. I don't have that answer, but it would be important to know, at least in my opinion. So when you look at this, and I'll just kind of go over this real quickly, the facet hypertrophy goes to show you that there is some kind of biomechanical issue going on. There's no picture, so I can't, see like the extent. Like I can't like really have like extra conjecture because I don't know what is what. But she goes over the fact, or at least the report says that there's desiccation. I always have trouble saying that word. I want to say dissection. That is not how you spell dissection. That is desiccation, which is essentially a fancy word for the disc is losing height and it's getting a little torn up in a way that's not healthy, obviously. Mild loss of disc height, that's pretty obvious. And likely reactive degenerative edema noted along the left L4, L5, S1, L5, blah, 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 end plate. So what does that mean? Edema happens in a bone once it's getting increased blood flow. Increased blood flow usually follows pain because blood flow has to follow where pain is because blood is how things heal. Usually, you will notice edema going in, they call it like a modic change. And modic is kind of complicated because it can mean a lot of different things. Sometimes it includes increased swelling, I guess. I don't know if that's the right word, but there may or may not be totally water in it, but they call it like a modic change. Usually that means that the bone is about to change in some way. Usually it means it's going to grow like spurs or something because it's getting to the point where the body's throwing enough blood in there and it thinks to it, the brain is like, okay, this area still hurts. I don't really understand why, or at least I keep trying to tell the conscious person, conscious Dylan, what's wrong, but they're not necessarily able to figure it out quite as well, and they're not making any lifestyle changes. I'll just change it for them. And so the modic changes essentially are the bone will grow in a way, or you'll have some kind of anatomical change to accommodate the pain so that your body's able to essentially survive a state of pain. I hope that makes sense. That's kind of that's a very complicated concept for what we're talking about here. I know a lot of chiros that don't really understand modic changes and all that, but it is super important to realize if you're looking at, diagnostic imaging, at least in my opinion. I'll probably put some, pictures up of like what modic might look like. If you can find them on the internet if you know what you're looking for. But when you think about the other parts of this, ligamentous and facet hypertrophy, again, it's interesting. Hypertrophy usually means that something's growing in a way because it's trying to establish stability. Hypertrophy, a lot of times, at least when it comes to the musculoskeletal system. There's obviously a bunch of other stuff that hypertrophies for worse or better reasons, but just so you know, hypertrophy usually means it's growing in size. So if you go to the gym and work out a lot, and then you do like a bunch of bicep curls, what'll happen is that your muscle will hypertrophy because it's getting stronger. So hypertrophy is not always a bad thing, but if you understand what the word means, it kind of starts to make it kind of informs your understanding of things. Hypertrophy usually just means it's getting bigger. When it comes to ligaments and facets, if it's getting bigger, it means your body's looking for stability. The body ultimately wants stability. It loves flexibility, but if it has to choose between flexibility and stability, it will choose stability every single time if it is able to, because flexibility is icing on the cake while stability is survival. Body's more interested in survival than it is in the bonus stuff that you're able to get access to if you take care of yourself. Now, she's got a couple disc bulges in here. Again, are the disc bulges still there? I doubt it based on the fact that she's not having any low back pain as of now. The interesting thing would be the L5-S1, because you see that disc bulge central left paracentral protrusion. Again, I could sit here and kind of talk about this forever, but when you see the central and left and right paracentral protrusion, what that means is that the back, so like if you have the actual disc itself, you're looking at like a side cut here. Here's the spinous process, and then the area between the disc, the area between the bodies, right here's the disc. If you have a paracentral bulge, what happens is that the disc is poking out and going into what you would call like the spinal canal. And paracentral means that it's usually paracentral means it's like kind of coming out in the middle, but because there's this big thick ligament there, it has to poke out to the sides, which is why it usually is a left or right paracentral, and central itself is kind of like its own thing. It's much more difficult to have a central protrusion just because of that thick PLL, as they call it, the posterior longitudinal ligament. I put the little abbreviation rant thing right there. And that's important to know, because if you are having a central ligament issue, or you're having like a central disc bulge, that tells you that the person's really putting a lot of weight on that disc and it's going through an insanely tough ligament. Why is it doing that? Well, there you go. That's what my job is to figure out why. So if she's having problems with tailbone, and again, I would have to kind of define what is a tailbone to this person. If it's numb, well, that's interesting, because that usually means that there's going to be some kind of nervous interference. But my question would be is if she's not necessarily suffering low back pain, but she's suffering a tingling or numbness in that. And again, does numbness mean completely void of feeling, or does it mean tingling? To a lot of people that means the same thing, while neurologically speaking it could mean a lot of different things. Because if you have tingling in an area, that could be poor blood flow, which informs a different decision based on what it is that you find as a physician, right? So whenever you have an issue going on in the tailbone area, you have to look at the low back, obviously, because a lot of the nerves obviously go through there. But sacrum, especially the SI joint, would be where I would put a lot of my focus on. Again, bar any other weird findings that I would find. And my guess, if I had to really take a lucky stab at this, is that you have tight leg muscles that are forcing that area to go into like a hyper lockdown mode, because it's scared that the core is not able to keep the what do you want to call it? Like, I guess the not the glute necessarily, but the pelvis still. And if your pelvis is moving in a way that the body doesn't like, all the muscles have to hold on tight. Hamstrings especially, and I noticed that inner hip. But, it's not necessarily the gracilis, but there's the muscles that go from the medial edge of the I'm humorous. I don't know what I'm talking about. The medial aspect of the femur that goes into the area that they call it totally drawn up, like the pubic area of the pelvis. Those can get especially tight, especially if the pelvis is leaning forward, because your hips have to rotate to accommodate that movement, which might be one of the reasons why standing and sitting and all that stuff is particularly debilitating, because it's trying to accommodate your hips being in the wrong spot so that you can keep moving, which again, the body wants you to be able to function. Whether you're happy while doing it, well, that's been more of a discussion. If you're going to the PT and all that, I would highly recommend you keep working on core. It sounds like core is probably one of the biggest ones. It may not necessarily be that the core is weak, but there might be a core engagement issue. I would make sure that this person is doing something like a bird dog, a leg lift if that's possible, any kind of like a good solid glute squeeze, a good, either squeezing it or actually doing something like a glute bridge. Yeah, glute muscles and core would be the main focus for me on this one, because of the fact that she is self-proclaiming that she doesn't do a lot of exercise, which means that her low back muscles are probably not super strong, or at least they're strong, but they're not necessarily engaged, because if she is a carpenter, that means that she's not necessarily like sitting around all day. And when you get these kinds of presentations, obviously if somebody's sitting at a desk, I'm thinking weakness. If they're not sitting at a desk, and if she is actually up and about, building stuff for sets and all that, because you figure theater work's tough stuff, then it means that it might be there. It's just not necessarily engaging when she's bending over. She might just be bending over loosey-goosey, and it's causing some kind of problem throughout the rest of the body. Could I be wrong? Of course. But there's a lot of information here that I can't get access to because of the fact that she's not a real person in the office. She is a real person. I shouldn't say quite like that. She's not a person that is personally somebody I have seen and met, so it's hard for me to get an answer to a lot of these questions. But these are some things that I would think about as a chiro, and I hope you find that kind of informative. Let's go into the first comment. All right, first comment. As others mentioned, core exercises, minding your back during the day, which means no bending at all if possible, at least until you feel better. Yeah, that sounds familiar. Trying to walk and move during the day, but never push through pain. Do everything moderately, step by step, as others have said. The McGill book, and try to follow it. I have a very bad herniation, which basically crippled me, and I managed to fix all the pain and symptoms by doing the very basic stuff above. All also proven by MRI. Sounds counterintuitive, but it seems to work. If you want to read, I did a post on my recovery with info MRI images before and after. Actually, that would be a good one to know, so I'm going to ping that over for later, in case you want to look that up. I agree, right? So you figure it sounds like core is something that person tended to help her. McGill, I don't think I've actually read McGill. I know I've heard of it. I don't think I've actually read it myself, but it is a very commonly referenced book to help people with low back pain. So I would highly recommend at least giving it a shot if you are somebody who has low back pain that sounds kind of like this. But again, I would worry more about muscles and all that, because even if you came to me and I adjusted you until the cows came home, you would feel better, no doubt. We would modulate the nervous system. You'd feel a lot better. Your muscles would actually probably get stronger more quickly if you were getting adjusted while also working out. There has been some science behind that. But I don't think adjusting and mobilizing only is going to help this. You're going to need to get your low back engaged, because again, it may not necessarily be weakness. I would highly recommend you, like this person was saying, you need to be conscious of it with your movement. So a lot of times whenever I recommend people walk, I say, hey, while you're walking, clench your stomach and really try and squeeze your butt as tight as you can while you're doing the walk, because that'll help your low back and glute area stay where they're supposed to. All right, next comment. All too complicated and bombastic. Do micro movements of spine constantly and many while lying, sitting, or standing. Move each part of the spine not more than 1 centimeter. You won't find that therapy anywhere. It's the homeopathic version of sports. That's an interesting take on it. I don't know how you're necessarily going to be able to detect if you're moving a specific part of your spine more than 1 centimeter. That might be kind of tough, but yeah, micro movements are going to be really good. Just make sure you're kind of moving. One thing that surgeons will recommend for people who are going for like a low back surgery is while they're laying in the bed, squeeze your glutes together, because that will cause micro movements in that area and it will improve your healing time significantly. Something to kind of keep in mind. Movement's good as long as it doesn't hurt. If you're doing a movement and it hurts, then you should stop. The way I always like to tell people is uncomfort's okay, pain is not okay. So if you're doing movement and you feel uncomfortable, that's probably fine. If you start to feel that pain, most people know what I'm talking about when they say, ooh, I'm starting to feel it coming. It feels like, pain's coming down the long road. Then you stop doing what you're doing. Figure out something else to do. Keep that in mind. Alrighty. It's going to take some time, but it will get better. I was in pain for over 2 years looking for answers on this same subreddit too. I had a herniated disc on my L5-S1 and 2 bulging discs above it. What helped me was reading Back Mechanic by Stuart McGill. There he is again. I recommend reading the book fully and not skipping any pages, and I promise you most, if not all of your questions will be answered. I thought it was kind of crazy that no one during my PT sessions recommended this book, as well as any of my PT friends, yet this book is written literally by a doctor who specializes in back pain. Anyways, it is definitely a must-read in my honest opinion. That's an interesting comment about the whole not being surprised that PTs don't recommend it. I'll tell you right now, I've been doing this job for quite a few years now, and to recommend something to a patient, there's a level of understanding of the human psyche, is what we're going to say. The thing is, a lot of times, patients will be like, can you give me this magic stretch, or can you give me a magic exercise that'll help take all my problems away? And I will do it, and I swear to you, with all that is all holy and powerful, that I'll do exactly what you say, and it'll take all my boo-boos away, and blah, blah, blah. I will tell you right now, there's probably a good, 70% chance they're just not going to do it. They're in pain, you treat them, they feel better, and then they ask you for this magic stretch or whatever that they're looking for, but what you tell them is not something that's necessarily, incredibly complicated. And you would think that would be a benefit, because a lot of times when people come in, I just say, just stretch your quads and your hammies. That alone is going to do super well. If you're feeling really frisky, then do a plank. But the problem is like they're such tiny things that people forget to do them over the course of their day because they're busy doing regular human stuff. Is that a bad thing? I mean, I'm not here to judge. If I were to think to myself like to do a plank every single day to make my pain go away, would I do it? Absolutely. Not a doubt in my mind. But there are a lot of different things that people value, and sometimes people don't value doing exercise to keep their pain away, but they want to go to the chiro and, get that to be handled for them. Is that a bad thing? No. Not at all. But I do think there's definitely limitations. And I will say that if people constantly, want to have different, because a lot of times, I'll get people come in and they say, hey, can you give me some stretch that'll take all my pain away? And I'm like, okay, here you go. Very simple, basic stuff. They don't do it. They come in and I ask, did you do those exercises? And I'm not judgmental about it. I guarantee you. I'm just asking a simple question. And they'll say, no, I didn't do it. I'm like, okay, well, that's fine. It probably was uncomfortable and you didn't want to do it, but whatever. Can you do that Can you do it next time I see you? And they'll be like, yeah, totally. And then at the end of the session, they're like, can you give me a stretch or whatever to help me take my pain away? I'm like, did you do the ones I told you? Did you do the ones I told you before? And they're like, no. And I'm like, okay, well, you are not ready for level 2 because you didn't even start on level 1. And I'm not even being mean about it, but I'm scared that if I give you something that's even more complicated, there's much more of a higher chance that you're going to hurt yourself in the process. But it's a different conversation if they come at me and they say, hey, I didn't do the exercises because they hurt. Can you give me a modified version of that? That's an entirely different discussion. But yeah, absolutely. We'll figure it out. There are many ways to, as they say, proverbially skin a cat, as they say. So if that's the case, I don't think the doctor should be even remotely blamed on not recommending a book. Are you kidding me? Like, there's a lot of people that are going through back pain who can't even take 30 seconds to stretch out their hamstring, which is probably one of the easiest stretches to do, all around. I wouldn't be surprised if a chiro is not necessary, or anybody really, is out there saying, you need to read a book. You're crazy if you think that's something that we could get used to telling people. And you should be honest with yourself on that one. Maybe you're willing to read it, and that makes you a much more powerful person than a lot of other people, but I've recommended books before, and let me tell you right now, nobody's ever done it. I'll tell you that right now. Alrighty, next comment. 6 months after an injury that bad, your nervous system is still in protective mode, which is why the standard stuff isn't breaking through. Some level, sure. One thing that moves stuck recovery is pool walking. No technique, no laps, just walk back and forth in shallow water for 10 to 15 minutes. Water takes the weight off your spine while your body's still moving, and movement is what signals to your brain that your back is safe again. That sounds too simple, but a lot of people find that's where things finally start shifting. Actually, that's a really good idea. I had not even considered that, but that is 100% true. Yeah, walking in a pool, that's probably actually a really good idea. If you don't own a pool, maybe if you have not a prescription. You don't get prescriptions at gyms. You get not a subscription. What's the word I'm looking for? You have you're a member. There's the word. Yeah, it did it. Did you see my brain malfunction there for a second? Yeah, if you could have a membership at a gym that has a pool, that's perfect. Even if some people are doing laps and all that, if you could just take one part of the pool, like this person's saying, to just walk back and forth, even if you're not going all the way to the end of the pool based on how deep it might possibly be, because usually pools get deeper. If it's like a more recreational pool. But if you figure if you're walking in the shallow part and just moving around, I think that's actually a really good way, like they were saying, to get movement in there that might be less stressful on the spine itself. I will actually have to consider that for my own patients because I hadn't even thought about that. That's a great way to do it. But because you hear about aquatherapy all the time, even for dogs and stuff like that when they get hurt, because you can't really tell an animal exactly what to do because they don't necessarily understand. But it's a really good way for them to just be able to move without as much stress going on because it helps kind of fight against the effects of gravity because of the buoyancy. That's actually a really quite profound thought. Big fan of that. I highly recommend that, actually. I think that'd be really good for a lot of people's low back pain. Consider me learned. Next comment. It took a lot of squats to fix my problem. It's the only thing that ever helped. Started with body weight, one leg, half squats, then goblet squats, Bulgarian split squats, leg press, and eventually hack squat and barbell squat. I train legs once per week, and the only exercise I explicitly avoided now is deadlifts, but my back pain is almost gone, and I don't have big flare-ups now. It was similar before. Couldn't sit, constipating numbness. So obviously this might actually be pretty good advice, at least for this patient, just because of the fact that they're having the issue probably with their core, low back, muscle strength. I have to tend to agree. I think body weight squats are great. They're great for just getting started for sure, because obviously you should be able to lift your body weight, no problems whatsoever, just to survive. Everything beyond that is going to be gravy, at least in regards to making sure that your back is functional. One-legged half squats can be anything one-legged is going to be really, really good for you in regards to making sure that your body's, equal strength on both sides. Half squats aren't too bad, but one leg half squats are going to be tough. That's going to be a pretty big jump going from body weight to one-legged half squats. Obviously, the one-legged half squats probably not. It's probably body weight as well. In which case, you're literally just like putting your leg up on something and going down into a squat. Yeah, I think those are great. I think these are all really great. I would highly recommend squats. I think squats are absolutely fantastic for you. Goblet squats, again, pretty manageable. Bulgarian split squats, that's where we start going into Dylan no likey land. Not because I don't like the exercise, but because Bulgarian split squats are brutal. Just a brutal exercise. I'm surprised that they would recommend, I guess he may not necessarily be recommending that exact order, but he says then goblet squats, Bulgarian split squats, and leg press. I would probably say maybe try to do the leg press before the Bulgarian split squats. Hack squats and barbell squats. I mean, barbell squats are probably, you know, the end all be all, I guess, if you're going to try, you know, put the barbell up on your back just as a whole thing. But if you're not ready to do squats, definitely don't put a bell on your back, because it'll just make it anything you do wrong will be amplified quite a bit. So just make sure you're ready when you put that thing on your back. And training legs once per week and only exercise. Yeah. And I've seen a lot of arguments to think that for people saying that deadlifts are not good for you. Deadlifts are not good for your back if you're not doing good core bracing. Whenever I do my deadlifts or death lifts, as I saw a couple weeks ago, I make sure that, you know, I have 245s on the side of the metal bell, on the metal bar. And then the very first thing I do is I just hold my stomach as tight as possible while I go down. I think any weight past that, unless you're going in for competition, you're more risking what you're doing with your back. I also don't like clanging the bell, because if you slam it onto the ground, you're not controlling the weight very well. If you go down and bounce off the ground, that's one thing, but the people that clang the thing into the ground in between every single lift, I think you're putting yourself at a bit of risk, because you're going all the way down and you might be potentially releasing the pressure in your stomach, which is not good. I say pressure in your stomach. I say bracing core is probably a better way to put it. You don't want just like pressure in your stomach. That might be actually counterintuitive. Just don't do that. But yeah, I think squats are good. I think that'd be a really good exercise for her, depending on if she likes squats. Some people just don't like doing squats, and it's hard to get people to enjoy something they don't like doing. That's up to them. But yeah, I think that's awesome. I think a good squat workout would be very good for her. Okay, let's do one more. Oop, I forgot to give this person a like. And I will say, going through all these, some of them are very unhinged. There's people like talking about doing like stem cells and all that kind of stuff, which is not good, not a bad thing, but I don't think it's generally accessible to most like regular run-of-the-mill people. But for the record, if you do look this question up on your own, there's a couple things in here that are a little bit unhinged, but she did ask for that, so it's definitely warranted. It was not unsolicited, but if you do look this up, there's a couple things in here. Kind of funny. I'm not going to go over them because I don't want to give any people ideas, but just for the record, that there's some weird stuff in here. So the last one I'm going to read, that L4, L5 herniation with nerve involvement is no joke, but the good news is nothing there looks like it needs surgery, so you've got time to actually fix the muscle stuff, which honestly sounds like that's what's been holding you back anyway, since your pain improved but the lockup stayed. Yeah, I agree. Again, just kind of goes with what I'm saying. I think working out the muscles is probably going to be your biggest benefit, and I agree. There's something in there that really gives me like surgery vibes, which was kind of why when I was talking about it earlier, you know, it was a little half-hearted. You've gone through conservative care, but I honest to goodness think that if you're going to these practitioners, they're doing a great job, but there's just like one key piece that they're missing, and maybe the thing that they're missing, and again, I don't know their treatment plan, so it's hard for me to say if it's them or you or whatever, blah, blah. And I'm not pointing fingers at who's to blame or whatever, but it does help illustrate like where the missing piece might be coming from. So it's something for you to think about. But I do think the L4, L5 herniation, obviously not a good thing. That is a pretty significant bulge, especially since it's going posterolateral and central and all that stuff. But is that what's causing the tailbone numbness? Maybe, because again, I don't know what you mean by tailbone. It could be quite easily. And I think just strengthening the muscle stuff, especially the core, should help fix the majority of that issue. And if it doesn't, well, then maybe we start talking about surgical type stuff, which might be warranted, as long as the surgeon believes that's something that would be helpful, right? I can't make that call, obviously. Not a surgeon. But yeah, there you go. So yeah, I think this one I'm only going to answer that one question because that's a pretty in-depth question. And I think if I were to do another one, this episode would be like an hour long. And I know some of the episodes go a bit long. So at this point, I'm just going to do this one. This one might be a little bit shorter, but I hope you guys enjoyed it. And I'll catch you guys next week. Make sure you got... Who's messaging me? Don't they know I'm working? Make sure you enjoy your week. I hope you keep it popping out there. Keep it nice and healthy and safe. And I can't wait to see you until the next one. Thanks for joining me, and I'll catch you guys later.